Hey everybody, this is Kelly Bailey with GRX Marketing, and I'm excited to come back for week 2 of our webinar mini-series on affordable, sustainable growth for independent pharmacy. And today we are really going to be focusing on building profitable services and implementing profitable products for sustainable revenue. I know a lot of pharmacies are really worried about the DIR shift come January, and they're trying to find new ways to generate cash flow or build additional revenue streams for their pharmacy. And now is a great time to get started on implementing all that stuff if you haven't already, so that come January, you can really hit the ground running with that. So first and foremost, the thing for you to consider is just finding a need in your community. What is something that is missing? What is something that you can offer? Whether that's through, patient surveys, trying to gauge what products they need, what services they would find beneficial, whether that's reaching out to local providers to see, what are some common health issues that they're addressing? Where do they struggle with their patients and getting them to be adherent? What are some things that our community is lacking that I can provide, whether again, that's a product or a service? Getting some feedback from people, doing a competitor analysis. What are your competitors offering compared to what you're offering? What's missing? Looking at your community as a whole and seeing, are there any underserved areas that I can focus on? So really just kind of doing an analysis of what's needed, what can I do, what's different that's going to stand out, that's going to be something that people are going to want because they can't find it anywhere else. So just kind of doing that kind of analysis is the best place to start. From there, it's just figuring out how to implement it. So whether that's clearing up some front end space, whether that's working with a local vendor to find and implement this new service that you want to offer, whatever it may be. The next thing for you to consider is how can you start charging for your time? And I know a lot of pharmacies are like, shoot, I've been offering free delivery and free MTMs or, free compliance packaging for so long now. I'm really worried that patients are going to get mad once I start charging for it. And I can tell you from our experience, we have helped numerous pharmacies start charging for services, and the pushback has been minimal. Having a letter put together, something very simple that just says, hey, because of the industry, the things that have been going on, it's not sustainable for me to be able to offer this as a free service anymore. I really appreciate your continued support for our program. I just am going to need to start charging for our delivery service, or I'm going to need to start charging for our compliance packaging, or I'm going to need to start charging for our medication reviews. Those things that you are giving away for free, start charging for those, because even if it's just a few dollars here and there, or $10 or $20, that's going to go a long way to helping build up that cash flow and getting people to appreciate your services more because they have to pay for it. And if COVID taught us anything, is that people are willing to pay for services they find beneficial. How many people, instead of sitting in at a restaurant, they paid to have it delivered to them, that type of a thing. So just thinking about what is it that patients utilize, where are you losing money, what services are you offering for free that you can start charging for. And again, it doesn't have to be a lot. For delivery, just a flat $5 delivery fee. Just think about all the deliveries that you make and how much additional revenue that could be. Or $5 to $10 for compliance packaging, depending on what product you have, just at a minimum to offset your costs. It doesn't have to be a lot. Again, just enough to cover for your time, and the benefit of this service is going to be huge. MTMs, we have a lot of pharmacists that have said, starting next year, MTMs, it's going to be the same as a copay, which that's a very reasonable thing to ask. You get 30 minutes of my time. We're going to do a deep dive on your medications. All I ask for is $25 to $30. It's the same as what you would pay a copay for a provider. It's cash-based. It's something that they find beneficial because they need it. It's beneficial for you because you're getting the money, but also you're helping build that connection with patients, and it's a beneficial service that you offer. So doing things like that, think about what you offer, what are you doing for free, and how can you start kind of charging for that? And then the other thing is, find vendors that support financial growth for your pharmacy. There's tons of vendors out there. They've been at all the trade shows that really focus on, how do you make money by either implementing a new service, or how do you change up how you do billing in order to get paid for the services that you're already offering? Or what are some new products that you can implement that are cash-based, that are really beneficial? They offer great profit margins. So, look back at your notes, look back at the vendor lists from all the trade shows that you've gone to, and find something that, again, is a need that you can supply for your community to really grow that. Inventory management, workflow operations, anything to help streamline and really save you money is going to go long way in 2024. And again, now is the time to implement those things, because it takes time. You have to notify patients of changes. You have to implement new processes in the pharmacy. You have to create whole new workflows. You have to do, teach and train how to implement these different things and do these different things. So now is the time to take action and get it done, so that come January, you can hit the ground running and you can start doing all this stuff. Patients have been notified, training has been done, new products and services have gotten in, and really hit it hard come January by getting started today. So those are just a few different ideas for you guys on how to build, additional products and build that additional sustainable revenue. If you have any questions, you're welcome to contact me at any time. My phone number is area code 515-280-2914. You can also shoot me an email to Kelly Bailey, KELLY.BAILEY@grxmarketing.com. I would love to talk with you about different things that you can do in your pharmacy for your community to really help build up that revenue. Thank you so much, and I look forward to talking with you next week.